Hello, everyone. Welcome back to St. Louis Teens, and welcome back to our series on COVID-19 heroes. Our hero today is Dr. Angela Reiersen, who is an associate professor at Washington University in St. Louis and a child and adolescent psychiatrist who is continuing to provide services to kids and teens during these difficult times. Thank you so much for your valuable service, Dr. Reiersen.
Hi, it's great to be here. Thanks for having me on the program.
Dr. Reiersen, can you tell us a little bit more about yourself and what inspired you to go into child psychiatry?
Yeah, so as you mentioned, I'm a child and adolescent psychiatrist. I live in St. Louis County with my husband, two teenage sons. My work at Washington University School of Medicine includes some teaching of doctors who are training to be child psychiatrists and evaluating and treating kids and teens in our clinic, school psychiatry consultations, and some telephone consultations to help pediatricians treat kids with mental health problems, and also do some research work. So when I first started medical school at the University of Southern California, I thought I might choose family medicine, actually, but then as it turned out, I really liked pediatrics and neurology and psychiatry, and I ended up doing child psychiatry in the end. And one thing I like about child psychiatry is the opportunity to intervene early to help children and adolescents, which I think may often prevent the occurrence of adult mental health problems.
And I know it can be difficult, but if you had to pick one part of your job that would be your favorite, what would it be? I know you talked about intervening early. Is this sort of your favorite part, or is there something else that you'd say?
Yeah, well, I mean, of course, that's a very important part, but I think one of the things I really enjoy most is doing the research part of it. I do a lot of research on neurodevelopmental disorders, ADHD, autism, psychotic disorders like schizophrenia, and some rare genetic conditions. And I just like that part a lot because the more we understand about the causes and development of these disorders, the better chance we have of developing new and better preventive interventions and treatments.
And due to the COVID pandemic, how has life changed for you and your family?
Well, I've had to switch to mainly working at home instead of the office. I've been seeing my patients through telemedicine, usually on Zoom, and would be instead of what we usually do, is see them in the clinic building. Of course, my son's school switched over to remote learning, which has been an interesting adjustment. I've had to cancel some travel that I was really looking forward to. Some of the scientific meetings I attend are now virtual instead of in person. And it can sometimes get a bit boring to stay in the house all day. So I make sure to take some walks out in the neighborhood, get some fresh air. And I've enjoyed doing some yard work and gardening when I need a little break from being in the house all day.
Thank you so much for continuing to provide your services. I know that these are very difficult times, and what you do truly helps a lot of teens and youth. I know that there's a lot of discussion and concern about the mental health effects of the pandemic. What has been your experience with this topic so far? And did the number of children and adolescents seeking psychiatric services go up? And what kind of problems are you seeing because of the COVID-19 pandemic?
Well, I'm not sure if we've had any increase in number of children who are asking for services through our clinic. I think that the number of referrals has been pretty steady. Just we're pretty busy at our clinic in general. But I have observed that some kids are handling the pandemic pretty well, while others are feeling really anxious or isolated. Some have done really well with the online school thing and may even prefer it. They may be less anxious than usual because life is less busy and hectic for them right now. Some socially anxious kids seem less anxious when they don't have to attend school in person. Maybe they even feel more comfortable participating in group discussions when it's on Zoom instead of being in person in the classroom. Um, Others are having trouble using the technology, and they have trouble keeping track of their school assignments when they're doing virtual learning. And I think that can be really difficult for kids with things like ADHD if they have trouble paying attention, keeping organized with the online learning. And some parents are able to help with this, but others are still working outside the home, or they have to work at home, and they may not have the time to supervise constantly and make sure their kids are keeping on track with the school's things. Um, it can be a big adjustment for families, I think. And some kids are feeling bored staying at home this summer without much to do. And this can increase feelings of anxiety or depression. I think teens who've lost loved ones or who are part of a minority community may be having a particularly difficult time right now.
And I know you were talking, and you talked a lot about, potentially many teens having increase in anxiety, or seeing other sort of detrimental effects. And would you say that these effects are due to COVID-19 and maybe the fear of the actual pandemic and the virus itself? Or do you think it's more due to the collateral effects of the pandemic, such as quarantining and not being able to socialize, being home all day, potential stress that has been caused by this? Or maybe is it a combination?
I think it can be a mixture of all of those things. I've heard about some very social kids who really miss seeing all their friends in person and feel very isolated. Some are anxious about the pandemic, getting sick, or about family members getting sick. I think there's some who maybe had some fears of germs and illness even before because they had anxiety or obsessive compulsive disorder. And so having an actual disease that everybody's worried about can make some of those symptoms worse. I think too that the SARS-CoV virus itself might cause some prolonged fatigue and perhaps some psychiatric symptoms for some people who become infected. So that could contribute for those individuals who get sick. Um, Luckily, most kids and teens don't get very severe symptoms, though, if they become infected.
And at this point, we are still unsure if schools will reopen next academic year. What are your top three measures that teens can take to keep themselves mentally healthy during these times of social isolation and the pandemic?
I think number one is some of those really basic things that are pretty simple, but we sometimes forget to do, like eating regular healthy meals and getting the right amount of sleep can really help people to feel more mentally healthy. Number two, making sure to take precautions against the spread of the virus can help to reduce anxiety and increase a sense of control regarding the current situation. So making sure to wear a face covering in public buildings or outside if you're going to be closer than 6 feet to other people, washing your hands or using hand sanitizer after you touch surfaces other people may have touched, trying to avoid touching your face, maintaining social distancing. All those things can help you feel that you have more control over the situation. And number three, it's good to have a list of things that you can do, calming things, fun things that you can use to distract yourself and improve your mood if you start to feel anxious, sad, or isolated. So this could include things like writing in a journal, doing artwork, listening to music, meditation, squeezing a stress ball, taking a walk, or any number of things. If you have a hobby you enjoy, spend some time on that. Depends on what works best for you. You might try asking others what types of things help them when they're feeling stressed. May also help to find someone you trust who you can talk to about your feelings and concerns. If you can't see someone in person, maybe you can chat using text, FaceTime, or Zoom. There are also some hotlines you can call or text in case of mental health crises. For example, you can find information about a crisis text line at www.crisistextline.org.
And I think another large part about keeping teens mentally healthy during these times are their families and their support systems that they have with their families. What do you think that families can do to support each other, particularly their teens and children?
Well, it can be really helpful to keep a regular schedule as much as possible when you're not having to get up for school or work at a specific time. Some people tend to sleep in and stay up late at night. They may lie in bed all day, get stuck in the habit of playing video games or spending too much time on social media. Then they might get frustrated when they realize the whole day's gone by and they haven't gotten things done that they wanted to do. Another thing is, I think it's good to schedule some specific time for planned family activities, whether that's watching a movie together at home, playing a board game, having a video chat with a grandparent, other friends or family, going out for a walk around the neighborhood, or working on a family project. And number three, I think it's a good time for it's a good idea for families to have times when everybody puts down their electronic devices so family members can just talk about how things are going and how they're feeling. For example, meal times could be a good time for everybody to put down their phone and just have some time to talk with each other.
This is all incredible advice. Everything from the things that you described with families, making sure to keep a schedule and potentially putting technology down, and what teens can be doing in terms of eating healthy breakfast and healthy meals every day. This is all very incredible, and I know it will help a lot of teens. If anyone is particularly interested, or if any teen has emotional distress and needs assistance, or having suicidal thoughts or other mental health concerns, you may text the crisis text line, and details and the link to the crisis text line will be provided in the description below. Dr. Reiersen, thank you so much for your service to children and teens and for giving us all your valuable advice. And thank you so much for your time today and answering all of our questions.
Thanks for having me. I enjoyed talking with you.